I'm Lucia Kalinosky from Just Us Health. I'm a MNSure Navigator and I use they, them pronouns. Today I'm going to be showing folks how to get the most of your MA. So if you already have medical assistance, which is Minnesota Medicaid, these are some tips on finding out a little bit more about what is covered, what doctors are in networks, things like that. So if you have MA, you'll first be on straight MA. Which is a transitional program, and then you'll be changed to a Pmap, P-M-A-P, which is Prepaid Medical Assistance Program. So this presentation is about you already have a Pmap and you want to learn more about it. So there's a couple of different Pmaps. We're going to be using UCare as an example, and I'm going to start sharing screen and show you how to find out some useful information about your Pmap. Okay, so you can open your browser of choice and search for the name of the Pmap and then PMAP. And we're looking for a landing page for consumers, for people who are on the plan. So when I search for UCare, I get a provider link that comes up first. So I skip down to the next one. And that brings me to this landing page, which has a lot of really useful information about the Pmap on it. It's got some contact information. We can scroll down and see this is some information about medical assistance in general. We've got some information about some sort of specialty programs that UCare offers. There's a smoking cessation program, free car seats for kids, a lot of other stuff here that you can learn about by coming to this page. But the real kind of meat of this page is this section here, current members, important information. So at the top, we've got the Minnesota Healthcare Program's Formulary, which is the list of covered drugs. We'll check that out in a second. We've got the a PDF of the programs, providers, and pharmacy directory. And then there's a question about question and answers about healthcare directives. That might be something you want to check out. And then the Pmap Member Handbook. So we're going to start by looking at the formulary. So that's just a link. It's going to bring us to this page where you can look up a medication. So just as an example, I'll look up sertraline. Wow, sertraline is covered. It's a tier 1 medication. So that's how you search for a medication. And then you can download the PDFs of the provider directory and the member handbook. So I'm going to show you that. So I'm going to stop sharing this web page and start sharing the PDF viewer. So here is the provider directory. So it has, this is a list of everyone who is in network with UCare. And again, we're just using UCare as an example. You can look for Health Partners or Blue Plus, Hennepin Health, whatever your Pmap you're on. So we're going to scroll down quickly and see that it's got all of the providers listed in the directory by name and by specialty and by region. You can also use the search function in your PDF viewer to look up a specific doctor. And then that can show you Joshua Jones is in network. So if you're looking for someone specific, that's a way to find them. So now we're going to jump over to the Pmap Member Handbook. So there's all kinds of information in here. We're not going to go over all of it, but I will give an overview. So just scrolling down. So you may have heard my cat, who I just put out in the hallway. He has lots to say as well, but we're going to stay focused on the Member Handbook. So here you can see there's lots of information on interpretation services, things like that, civil rights notices, how to file a complaint, important information here. We're going to skip down some more. Table of contents. So some of the types of information is in here. Contact information, things about prior authorization, what's covered, what's not covered, all sorts of things, member bill of rights, lots of useful information here. So we're gonna skip down to some of the contact information. I think it's good for folks to know that all of the Pmaps have behavioral health triage lines. So that is if you are in mental health crisis or not sure if you're in crisis or what does that even mean, this is a line that you can call and find out what kind of care might be useful to you. I'll go back. Chiropractic services are covered. Not everyone knows that. More about interpreter services. And I think it's good for folks to know about the nurse line. So if you're sick or you're not quite sure what's going on and you just want to talk to a nurse, tell them about your symptoms, ask them what might be useful, the nurse line is helpful as well. So a little bit further down. Okay, so there's information here about copays. This has some of the different things on medical assistance that have copays. So if you get billed for $3 for a non-preventative visit, that's why. Here's a list of things that don't have copays. So these are covered services that don't have copays. And then here's a list of all different kinds of covered services. So acupuncture is covered. A lot of people don't know that. It might be something that you're interested in looking into. There's some different things are covered for kids than for adults. Typically more things are covered for kids and teens than adults. Some chiropractic care and dental care is covered. And then we'll get down to this long list of all the different kinds of medical care that's covered. So I'm not going to go through all of it. Mostly I just want to know, want people to know that those handbooks exist. And if you're, I find that when people look through those handbooks, there's more things are covered than they expected. There's a lot of good resources in there, things to check out. Yeah, and if you're not sure if you're eligible for medical assistance or you need help reapplying or renewing your coverage, that's what the healthcare MNSure navigators at Justice Health can do. So thank you for listening in.